Welcome to today's Congressional Neuroscience Caucus briefing on the current and future directions of traumatic brain injury. My name is Mark Resnick. I am a distinguished professor of psychiatry and neuroscience at the University of Illinois College of Medicine and a research career scientist at the Jesse Brown VA Medical Center. But most importantly, for today's meeting, I am board chair of the American Brain Coalition. And the American Brain Coalition, together with the Brain Injury Association of America, is partnered with the Congressional Neuroscience Caucus to host today's briefing. The Congressional Neuroscience Caucus is co-chaired by Congressman Earl Blumenauer and Congressman Morgan Luttrell. It was established in 2010 with the intent to build awareness of the intrinsic role brain research plays in understanding ourselves and our society, and to help communicate the progress and the benefits of brain research and promote changes in federal policy to support critical research in neuroscience. So both co-chairs are passionate about brain science. Congressman Blumenauer has a deep and abiding interest in brain research and was the founding co-chair of the caucus. Congressman Luttrell also brings a personal passion to the subject of today's briefing because he survived a helicopter crash in 2009 that left him with a traumatic brain injury. After retiring from the Navy, Congressman Luttrell got an advanced degree in applied cognition and neuroscience, and he currently, in addition to being a member of Congress, helps fellow veterans recover from PTSD and traumatic brain injury sustained in battle. Unfortunately, neither Congressman Blumenauer nor Luttrell is able to join us today. I'd like to now introduce Dr. Jeff Manley, who will both initiate and moderate today's briefing. Dr. Manley is Chief of Neurosurgery at San Francisco General Hospital and Professor and Vice Chair of Neurological Surgery at the University of California, Los Angeles. Dr. Manley.
Yes, thank you very much. Appreciate the introduction, and thanks everyone for making time to join us today. It looks like we've got a lot of folks that are on this Zoom call. I just want to say up front that we have a very important problem that we need to solve that's been with us since the beginning of time. I just speaking for myself personally, and I'm sure I speak for also for Tina Master and for Rick as well. We're available at any time to answer any questions that you might have in the future moving forward as it relates to traumatic brain injury, as we are all fully committed to this, to really trying to make a difference. I thought I would start today with just a brief overview before we switch over to the Q&A and introduce some of the other folks on. But just briefly, this remains, as I said, a public health issue that's been with us since the beginning of time. And currently, if you look at the CDC website, there may be 2.8 million people that have been documented with a traumatic brain injury. Estimates from some of our emergency medicine colleagues would suggest that that's probably not correct. It's probably in upwards of about 4.8 million. And some of our recent work from our institution and several others of other papers have shown that we're probably missing half the people that have a traumatic brain injury, or like in Tina's world, that they're coming and talking to their athletic trainer. So we really don't know exactly how many people have traumatic brain injury. The coding is also an issue. And so when we think about, the most reliable data that we have, this comes from the CDC Injury Center and from their epidemiology that they have to help us to guide this. And, frankly, just to put a plug in for the CDC, I think they're woefully underfunded to do this work, given the scope of the problem and the cost of this to the American public. I think that, notwithstanding some of these issues with understanding the surveillance and the numbers, this is a pretty exciting time in traumatic brain injury. I think with the conflicts in the Middle East, with the rise in publicity around what happens to professional athletes, there's a greater awareness of traumatic brain injury than we've ever had before. And we look at a lot of diseases. I'm a neurosurgeon. I've seen a lot of things over time that we have less of these injuries over time. Traumatic brain injury is increasing over time. It's increasing because of the awareness And it's increasing because the heart docs, the cancer docs, the joint replacement docs, they've done a great job. And we have many, many people that are in their 70s, 80s, 90s who are very active, and they're falling and they're having traumatic brain injuries. So in the state of California, we documented in a paper that we've seen a 40% increase in traumatic brain injury in the last 10 years. So this is not a problem that's getting less, it's a problem that's getting more, and we need to get ahead of it. Now, some other good news to share, though, is that over the last 10 or 15 years, there has been some investment, predominantly through the Department of Defense, that's really helped us to better understand traumatic brain injuries. So today, we know a lot more about how to image these folks with MRI scans and with CT scans. In the past 3 years, we've had 3 clearances from the FDA for blood-based biomarkers. So we have a blood test that can help us to manage traumatic brain injury. And we understand a lot more about the natural history than we used to. However, again, this remains a major public health issue that is woefully underfunded. Why do I say that? So if we look at the funding through the NIH last year, it was somewhere around about $110 million, $110 million for a growing problem in this country. And just to put this into perspective, at our hospital at San Francisco General, when we have somebody that comes in a coma that has what we would call a really significant brain injury, a lot of them will go to the operating room. I will operate on them. We'll put them in the intensive care unit. They will be there for a week or two. They then go down to step down. We eventually try to get them into a rehabilitation setting, which is a whole other thing we could talk about. Super challenging to get rehab for patients with traumatic brain injury. We think that only 1 out of 5 patients that needs rehab is actually getting it today. But when you look at that all in, the cost for that is somewhere between $3 and $5 million per each patient. So if you back into those numbers about how much money the NIH is spending on a problem that costs this much, it's really about 30 of those sick patients. And I see a patient like that every week just at one hospital. So the mismatch between the burden and the impact, not only on the individuals, but also this disables their families too. So there's a huge impact on those that are around them. And I would venture to say, as I sort of wrap up here to turn this over, is that just think about this. I see right now that we've got 46 participants on here. Who on this call has not actually had a quote unquote mild TBI or a concussion? I bet you if I asked that question and I could see hands, probably at least a third of you, your hands would go up. And then if I ask you another question, which is, how many of you know somebody that's had a concussion or an event like that, or, God forbid, a more significant injury where somebody was in a coma? Most of the hands would go up. So this is not a rare disease. This is a very common problem that we're certainly happy that you're here to hear what we've got to say today. We're happy that the American public is more aware of this. I mean, even when we look through our congressional constituency, I won't name names because that's inappropriate, but we can look across and identify a number of our members who actually have sustained traumatic brain injuries. Why? Because it's a common problem, and it's a problem that we need to get ahead of. And we actually need your help to have the kind of legislation that we need in order to push this forward. So I will stop there. And I think we can go ahead. I believe that Katie, first we were going to introduce Tina. Is that correct? Yeah, so my great pleasure to introduce my friend and colleague, Tina Master, who is a powerhouse in pediatric brain injuries, and in particular, those that occur in sports. And this is a really super important problem that she's going to tell you a little bit about. It's been associated with poor performance in schools, people going on to be incarcerated. There's a lot of reasons why we need to get ahead of this early. And Tina has really been a leader in trying to understand an area that we're all very interested in. Because what I was just talking about is what happens in a hospital. We're doing a pretty good job there, but once you leave the hospital or you leave the sports field, the system of care that you have is not like when you have cancer or heart disease. In fact, there's no system of care. And I know that sounds like a bold statement, but it's true. So with that, I'll turn this over to Tina. She can tell you a little bit about some of the exciting work that she's been doing. And again, we'll sort of tee up for some questions that I hope you guys will have and we're eager to answer. Thank you.
Thank you so much, Jeff. I really appreciate this opportunity to address all of you. And again, I think want to echo what Jeff has said about this being really something of an invisible epidemic. As an injury, traumatic brain injury is often invisible, especially the mild traumatic brain injuries that are so common and the most prevalent. And so I want to tell you a little bit of a story, maybe to highlight how far we've come and yet still how far we have yet to go. And so if you can think about what happens, on Friday nights across the United States in the fall, in the evenings, under the lights, with a lot of kids that I take care of in the office here at Children's Hospital of Philadelphia and our Minds Matter concussion program. Everyone's excited because it's time for football when fall comes around. And back in the day, there are probably some of you staffers who are old enough to remember that when you played football and if you got an injury and there was concern about getting your bell rung or getting a ding, that actually, the assessment often was, you look okay, going back out there and see how it goes, right? And so I think we have learned now in the last number of decades how that all went, that actually was suboptimal in terms of how we would take care of our athletes in that setting. And what we've learned really is that when we identify kids with concussion and get them off the field and get them properly cared for, we actually get better outcomes. They get back to play sooner. They don't have all the long-term issues that sometimes can linger with problems with school performance, even returning to activities such as sports, that basically that kind of identification really makes a big difference. I can imagine also on this call, there are staffers for whom that's actually a foreign concept because you all grew up during a time in the last couple of decades where actually if you sustained a possible head injury and there was a concern about a concussion, you were actually removed from that game. And there were actually laws now across every single state in this country that mandate early identification, removal from play, and being cleared before you return to play. And what kind of impact has that had on concussions and outcomes in youth athletes? It's been tremendous. What we know is that when we remove kids from play and we return them safely back to play, we actually decrease the rates of repeat concussion and we decrease the rates of catastrophic brain injury on the football field, which we're hearing less and less about these days because of the 5-day return to play plan that all athletes have to go through because of the state laws that have been implemented across the country. And so that makes a huge, huge difference in lives. And why is that? It's not just about football. Obviously, that's a big sport that everybody thinks about in concussion. 5.6 million kids participate in football across the country. But really, it's any sport. And when you look at the most recent data that we have, 70 million kids participate in organized sports across the country. That's tremendous. And so it's important to recognize that it's not just football, but it's also all the kids that participate in sports. And there are high rates of concussion that happen in girls soccer, boys ice hockey, girls lacrosse. So that's really important to keep in mind. As a pediatrician and a sports medicine pediatrician, we take it really, really seriously that our constituency kids don't have the opportunity to vote and they don't have a voice unless we speak for them. And so it's really important for us that we highlight that. And then in emergent research that we've actually put out from our Minds Matter concussion program at CHOP, we just recently published in the Journal of Pediatrics that in 5 to 12-year-olds, the majority of concussions actually happen in non-sports settings. And so how many of you out there, like Jeff had mentioned, not only maybe have personally sustained a concussion, maybe sustained a concussion and know someone who sustained a concussion in sports, but also potentially in a motor vehicle crash or in a fall. And so I think from that standpoint, really important that those are the folks that maybe are not getting recognized because all of the awareness that's happened in sports makes us think in a little bit of a tunnel vision way that really, I just have to worry about concussions when it comes to football. But it's not just football, it's also field hockey or even swimming or track. And everybody's thinking about that right now, the Olympics going on. But even outside of sports, really important that actually we recognize that it happens outside of the athletic setting as well. And in those injuries, really important because those people aren't actually getting the care that they need to get. Pediatricians, family medicine doctors, emergency room doctors don't always know what the most up-to-date data is in terms of how to manage patients with concussion. So we're really working to try and increase that as well. And that requires real effort and real bandwidth. And what we're really realizing is that we have to move towards a concussion-aware community. it's not just about the doctors. It's not just about the surgeons. It's not just about the athletic trainers and the coaches. It's the parents, it's the families, it's the community really recognizing where concussion happens, how it can occur, how to get in and see your pediatrician or primary care doctor and have them be equipped to take care of you. Because the other thing that people may not realize too is that it's not just about wait and see with concussion now. We now actually can treat concussion, and that's an important message to get out there. I just saw both children and adults today in my practice earlier this morning who were seen in the ER and in their primary care setting where they were told, well, you're going to be just fine. Just give it some time and you'll be all right. And days or weeks later, that's not the case. And so I do want to highlight that, again, one of the things that we want to really give a shout out to, this is the 20th anniversary of the Heads Up program that's been put out through the CDC. The CDC Injury Center was constituted in 1992 after a National Academies report indicated that would be an incredible impact on public health and wellness for people in our country. And from the perspective of what's happened with Heads Up, it is a go-to resource for pediatricians, patients, families, coaches, volunteer coaches, parents who are out there. They're looking for the right information on how to identify and diagnose and manage concussion. We don't want to lose that. And so we would want you to absolutely reconsider reinstating the funding for the CDC Injury Center, which is currently at risk right now in the current appropriations bill that has been proposed. And so please think about that because that'll have a huge impact on concussions and children and the folks across the United States in general. I think I want to just end and highlight that basically we are only always just one generation away from forgetting how it was. I think for those of you who are staffers who know what it's like to have a return to play process to make sure that you return to play in a safe manner, it wasn't like that for us when we were younger. And I think those of us speaking can attest to that. And what we're learning now is that we actually can treat concussion. At CHOP, we just published the first paper that describes a nutraceutical treatment for concussion. So we're moving forward, not just with rehab approaches and active management of concussion, but actually potentially a treatment. So we're really on the cusp of a new era where we don't want to hold back in terms of where the science is taking us. And this science is also taking us towards brain health and wellness. What I want you to think about is traumatic brain injury is really the flip side of the coin of brain health and wellness. And so what we learn in traumatic brain injury from concussion, mild, moderate to severe, really has an impact and what we know about how to keep ourselves all healthy with regard to our brain health and wellness. And so again, I am so thankful to Congressmen Blumenauer and Luttrell for constituting this caucus. It is so important. As Jeff had mentioned, we are here for you to answer any questions that you have across the board, whether it's mild to severe traumatic brain injury, whether it's children to adults. We want to give you the answers that you need to be able to advocate for those who aren't always as able to advocate for themselves because we know we have to be their voices. So thank you so much for this time and thank you for this opportunity and looking forward to having some conversation after this.
Great. Thanks, Tina. That was wonderful. And, you brought up a very important point, which is that, why do we not see more advocacy out there if the problem is so huge? And, for those who have actually sustained a more significant head injury and are now recovered, and there could be one of you here, with us today, you'll realize it's a slog, right? And it's a long road to recovery, and it's awfully hard to be trying to take care of yourself and recover while you're advocating. And also your family and your friends are there right with you, helping you to do this. And, when we've done some outreach and looked at this, there's a lot of fatigue around this, which is why we believe that, we need more advocacy. And speaking of advocacy, we have with us today Rick Willis, who is the president and CEO of the Brain Injury Association of America. And this is a small but growing and mighty group here that we really need as part of our whole team, if you will, to help us. It can't just be physicians. It can't just be physician researchers. As I said, the patients have a hard time speaking for themselves. And so we need folks like Rick who are out there representing patients and their families to do the advocacy that we need to garner the resources to help move things along. So with that, I'll turn this over to Rick.
Great. Thank you, Jeff and Tina. Great to hear from both of you. And I think as I go to share my screen here, because I do have a few slides that I wanted to go through, I think you're going to hear a number of common themes in what I review and discuss, and what you heard from Jeff and Tina. We definitely do need an aware community, a concussion-aware community, a brain injury-aware community. And this is an unfunded national epidemic. And if you're not convinced already from what you've heard so far today, I'm hoping to actually paint a picture for you with some of the faces, and you've heard, and some of the voices, and you've heard that term used already. And if you're not familiar with the Brain Injury Association of America, I wanted just to let you know that there's a number of things that we are focused on. So when we say that we're the voice of brain injury in the brain injury community, what we mean by that is we're focused on prevention, making more people aware of what brain injury is, such as what we're doing here today, and hopefully preventing more brain injuries. But we also fund research, elevating best practices in treatment, making sure that we're elevating education about brain injury and among both survivors, caregivers, and professional, and of course, advocacy and policy work, and bringing again voice, and elevating voice, and amplifying voice for those who can't speak for themselves. We're also the nation's largest network when it comes to brain injury. So we have a network of state-based affiliates all across the country. And we are the place where people who have care for or treat someone with a brain injury turn for connections and resources and community and expert guidance. And in fact, you may not know that at the Brain Injury Association of America, we field more than 20,000 individuals a year who turn to us for those supports. And it's people like someone that I want to introduce you to named Bethany. Bethany reached out to our organization. She is a caregiver for her father, who suffered a traumatic brain injury. And I hope that you will indulge me, because I actually want to read her email to you in its entirety. It'll take me 20 or 30 seconds here to get through, but I hope you'll see the point for why when I get through this. She wrote to us and said, "Hello, my name's Bethany. I'm a caregiver and medical advocate, mostly for my father, James. He suffers an acquired TBI, or beg your pardon, a severe TBI from an auto accident 28 months ago. He just turned 65, and I'm 36. I'm crying out for help here. I've ventured every single rabbit hole known to man. I've sought agency after agency, doctor after doctor, website after website. I listen to as many podcasts as I can. I've read almost everything there is to read online. I've read so many books and watched the very few documentaries that exist. What I need is," and she lists her needs, "I need advocacy. I need advice, tips, tricks, support, more knowledge, help, guidance, even more knowledge, tools, trials, the best doctor in the world. I need to see other people my dad's age who have a severe TBI and live like him. I need to know what doctor wants to take on and learn about the most complicated TBI patient ever. I have never seen or heard about anyone with a TBI that's close or similar to my dad's. I need there to be more information. I need people to see what it's like. I need resources, and I need someone to have my back. Please help us." And she closes, "I just need to know what people's experiences with medications are, what tools they're using. Is there a way to help their loved ones who have aphasia be able to express themselves where caregivers and nurses can understand? How can I help him remember where he is and why he's here? Is there a device or a communication that can help? How do I keep him from being bored? And how do I slow down his thoughts and his worry and his fear?" Now, I want to ask you, imagine for a minute. I want you to put yourself in Bethany's shoes. And I want to ask you, maybe more importantly, I want to ask you to put yourself in her dad's shoes. And I want you to imagine that maybe you don't have a Bethany. And I want you to imagine that you're going through everything that she's just described, when those around you are either telling you that you just need to get used to it, they're accusing you of maybe faking it, and they don't believe you. I want you to imagine what that challenge would be like. And the reason I tell you Bethany's story is because it's what we in the brain injury community know is that brain injury, it isn't just an event. It's something that is the start of something that is often misdiagnosed or misunderstood. And unfortunately, the reason I ask you the question about putting yourself in both Bethany and her father's shoes is because that is the experience of all too many people who have brain injury. And yet, the public public perception, and arguably, I guess I would say, our healthcare system, the belief is more that brain injury is an acute event. It's maybe more like breaking a leg, right? We tend to think of it as you get a cast, you go get a little bit of PT, you spend some time resting up, it heals, it gets better, and you're on your way, right? What we actually know is that it's not like that at all. And what you can see on the screen is that brain injury is actually what we would consider many times, for many people, a chronic condition. And you can see a bar graph that's on the right there. So when you look at the data, I think the thing that you should look at when you see this is that focus on the same column. 22% stayed the same. Look at the fact that you had 26% improved and you had 30% became worse. So for 56% of the population in this particular study, which, by the way, is from the TBI model systems, it's a collection of 16 centers around the country, which arguably, when it comes to brain injury, are a national treasure with some of the longest longitudinal data sets that exist on people with brain injury. And this was a study, a 5-year study of outcomes, as it says, for individuals post rehab. So you can see that it was anything but static. It was anything but like a broken leg. And so you might look at the became worse column and you might be thinking, well, what happened to those folks? And it further underscores, when you drill into it, what we're saying here about brain injury being a chronic condition and not static. And when you look at the folks who got worse, there's a lot of reasons why they might have gotten worse. They got worse because of the risk for degenerative processes, or they might have had reduced activity levels and it produced comorbidities, or they had financial burdens and couldn't get the help that they needed, which actually made their condition worse. So what I want you to hopefully take away from looking at this, if you were thinking about brain injury, you're thinking about concussion, and you're thinking, yeah, you just rest up, you look fine, and you get on your way. It is not that way at all, and the data certainly supports that. And that's why at the Brain Injury Association, we are focused on elevating recognition of brain injury as a chronic condition in partnership with our friends like the American Brain Coalition or the Congressional Neuroscience Caucus, or I would say the Congressional Brain Injury Task Force, which I hope you have heard from and would certainly consider joining. But Beth's story, which I shared with you just a few moments ago, illustrates for you what, again, the lived experience of those who never saw a brain injury coming in their life. They didn't wake up and expect to see this happening to them or their loved ones. And it illustrates what it's like. You can imagine what it would be like to navigate on your own. But I want to tell you about the story of Angela McConnell, who further illustrates this experience that brain injury isn't a single acute event. Angela, who's from Florida, indicates that the most common myth that she's encountered about brain injury is that once the initial injury heals, everything returns to normal. People think that injuries are temporary setbacks rather than lifelong conditions that require ongoing management. And the misperception leads to it often overlooks, I should say, the persistence and often invisible challenges that people with TBI face every day related to cognitive deficits, memory problems, and sensory issues. So I hope in the few moments that I've had with you that if you, as Jeff alluded earlier, if you're one of the individuals who knows someone or perhaps had sustained, heaven forbid, a concussion yourself, if there was any belief that this is something that is an acute event and you just simply go and get better, for some folks that does happen. We'll certainly want to acknowledge that. But I hope that you're taking away that for many folks that doesn't happen. And so to really sort of put it in perspective, our issues, if I were able to summarize, is what I've talked about so far, that we have a gap in awareness and that, again, people think of brain injury as this one-time event. We also, in our country, we have a focus on the acute. And so whether that is our healthcare system or insurance system, is primarily focused on the point of injury. And as you heard Jeff say earlier, that we have a funding issue as well, that we can extrapolate, we can look at what we know to be true about the incidence of brain injury. We can say it is far bigger than what is currently being funded or what we know the prevalence of brain injury to be. So our issues are around awareness, the focus on the acute, and the scale of the issue. And if I could be so bold, then what we need with respect to those issues is we need to increase awareness. And so for those of you who are here on the call, as I alluded earlier, we are here in partnership with our friends. I hope that your bosses, that you will take back to them to consider joining the Congressional Brain Injury Task Force and or the Congressional Neuroscience Caucus if you're not already a part of that, and that's why you're here today. But when it comes to public health resources, I will also add my underscore to the Injury Center and to the CDC and why it's vital, completely underfunded. If you look at the National Concussion Surveillance System, which is an initial investment, I might say, to be able to better understand the prevalence of brain injury in our country, they're currently receiving $1.5 million, $1.5 million a year to be able to address the scope and the size of the cause that we've been talking about here. And what we know from the initial pilot, from the $1.5 million that the CDC has received for the National Concussion Surveillance System, we know based on that data that the incidence rate is 30 times more. It's underreported by 30 times in adults when it comes to concussion and 17 times in children. So we know we have enough information to extrapolate that it's far bigger than what we realize, but we need more funding to be able to put more numbers to that and to be able to understand the long-term impact. And then lastly, what we need is expanded private insurance benefits and supports, particularly in Medicare and Medicaid. And so I realize that's a very large issue that time doesn't allow us to go into. I would say that I want to acknowledge certainly that as recently as June, that CMS has added traumatic brain injury as one of the chronic conditions that is on their chronic condition list on the Medicare Advantage side. That certainly is a big step forward. We need to make that translate into real care and increased access for survivors and their families. But I would also say, if there was another takeaway, is that you consider supporting, if you have your boss's support, reauthorization of the TBI Act, which will be coming to both the House and the Senate floor for a full vote in the not too distant future. So certainly encourage you to be a part of that. So as I wrap this up, I wanted just to bring to you one last story, which is actually from Paige Melton-Ivy, who happens to also be the board chair for the Brain Injury Association of America. And as a caregiver, her husband suffered an anoxic brain injury from a deprivation of oxygen from a stroke. And as her caregiver, she really has highlighted for us, this issue of focusing on the acute and what happens after that. Are individuals with brain injury being supported with therapy? You've heard Jeff talk about how many go on to therapy and the challenges related there, but also residential options and making sure that there are resources and providing continuing support, and whether that is from insurance or community resources. There is a long road after the initial acute event, and we have to remember that. But I highlight Paige's example because what you would not know, and she gave me permission to share with you, is that in her family, she has others with chronic conditions. They have an asthmatic in their family. They have a type 1 diabetic. And no one questions the chronic nature of those disease states. The individuals in her family, they get the meds that they need. Her type 1 diabetic, they get their insulin. But the one who is arguably the most disabled, her husband who suffered the anoxic brain injury, who needs the longest term care, has to continue to fight to be heard and to be recognized as having a chronic condition in his brain injury. So I'll leave you with this photo. This is the brain injury community for Brain Injury Awareness Day on Capitol Hill. I want you to know that the brain injury community does have a powerful voice. They are not always able to use it individually for themselves, and that's why we're here today and why the Brain Injury Association of America does what it does. We will be back on Capitol Hill on Wednesday, March the 5th next year. So I hope that you will be on the lookout for all of our folks wearing blue proudly and calling on your offices. So thank you for being a part of today. And I'll certainly, Jeff, pass the baton back over to you.
Great. Thanks. So we're already starting to get some questions. And the first question I would like to address, and again, I encourage everybody to speak up because we're here to try to help educate here, is that a question came in by email where, Dr. Master was mentioning that, if this House Appropriations bill where we were going to have zero funding for the CDC Injury Center, what would be the impact of this? And I can just tell you from my perspective, it would be profound. not even just considering, traumatic brain injury, but trauma and injury in general is still the leading cause of death in people under the age of 45. This is what, between, 0 and 45, if you're going to pass away, this is what's going to do that. This is what's going to disable you. And there is no other federal agency that owns this besides the CDC. And, even what they get is minimal. I mean, Rick just said $1.5 million. I just told you that one patient that we have costs $3 million, and they're only getting $1.5 million to do this work. From even if you want to take all the emotion out of this, from a federal fiscal perspective, this makes no sense whatsoever. If we do this, in my opinion, this will cost the American public a lot of money. The amount of money, in my opinion, that's going to the CDC is actually paltry compared to the scope of this. But Tina, do you want to just answer that, and we'll see what other questions are coming in here.
Yeah, definitely. I would absolutely underscore and echo what Jeff said in terms of this proposed elimination. It really sets us back decades, if not half a century or more, in terms of our advances in traumatic brain injury. It would eliminate brain injury programs such as the Heads Up program, which does both education, advocacy, and raising awareness. That is a huge part of the reason why we are more concussion aware as a society now in the United States than we were even just 15 years ago. And again, we just celebrated the 20th anniversary of Heads Up. And then the National Concussion Surveillance Program, the Core State Injury Program, these are all programs that actually help us understand the breadth of injury and the impact it has on the U.S. population. And as Jeff said, it is the #1 killer of young people. And so not just children, but also young adults. And so I think that that's something that we have to keep in mind. I think as we have so much awareness about how important surveillance is coming out of a global pandemic with COVID-19, I think it's very similar to just think about how injury can't take a back seat like it did for many, many decades until the Injury Center was instituted back in '92. And so that's not that long ago. We made a huge headway, and we need to make sure we don't lose that ground by eliminating this funding, which again, in comparison to lots of other budgets that are out there, is relatively small in comparison, especially to the burden that it is for our population here in the United States, and certainly for your constituency.
Yeah, and just sort of looking at our time here, we've got about another 22 minutes. I see we've had a number of questions that have popped up. I'd like to maybe take the first two, and then it looks like Mark has a couple of questions. So there was a question from Paul Arovich talking about the environmental risk factors for traumatic brain injury, and in particular, what are the consequences and the association with dementia? So there are many studies showing the association between having a traumatic brain injury and dementia, but they're association studies. Historically, because 30, 40 years ago, this was more common in young males. We actually excluded anybody over the age of 65 from these traumatic brain injury studies. So we really didn't know much about that. And to my knowledge, there's only 2 federally funded grants right now that are looking at traumatic brain injury in older folks. And we are fortunate to have one of those. And what we found is actually very, very scary. So we're seeing that people that come in with older folks with traumatic brain injury, 40% of them, it's their first diagnosis of a mild cognitive impairment. So we need to understand that these two things can go together. But what we've seen that's even more frightening is that when people may have a little mild cognitive impairment and they get a traumatic brain injury, it results in this fulminant, aggressive, rapid decline in their dementia. And so we need to understand this better. This is a huge issue. We've done some back of the envelope calculations, and I know everybody is very, very focused on Alzheimer's, and they should be. Anybody that's had somebody in their family that's had dementia, it is gut-wrenching. But what I can say to you is that it looks like that we may have as many older adults having brain injury and cognitive decline from this as we have with Alzheimer's. But because we're only spending $1.5 million a year to understand this, we don't actually know. And so it's only little studies like this that are done at 2 or 3 hospitals that are like the tip of the iceberg of a very scary problem. The next question quickly is what's going on with blood-based biomarkers? Super, super exciting. If any of you guys have ever had chest pain and you've gone into an emergency department, what do? They don't use a stethoscope anymore. They order a test called troponin that rules in or rules out that you're having cardiovascular issues. These tests that have been cleared by the FDA are very much the same thing. Dr. Master and I are working on some work right now with BARDA, which many of you guys are familiar with, and with Abbott to try to use these for an aid in diagnosis, a sort of troponin of the brain. So pretty exciting stuff. We've got a lot of great things going on that are going to help us, but we need that back end. So we diagnose traumatic brain injury. If we don't have a way to take care of these folks, what are we going to do? So I'll turn this back over to Mark for a second. I know, Mark, you have a question, and then we'll get back to the growing questions that we have in the chat here.
So I have 2 questions, and they're both related to neurobiology. The first one really comes out from what the American Brain Coalition is, which is trying to amalgamate so many different fields. And I know that a large number of people who suffer traumatic brain injury, whether it's from a stroke or from the outside, are depressed. And I wonder if you can comment on what is the biology of that and how does it work? The second one is, we've talked about, Jeff, you talked about having acute traumatic brain injury in the patients that you have to do surgery on. And Christina, you talked about football, let's say. So the continual, either a concussion or, hitting someone's helmet 30 times in a game. Is there a difference in the biology and the traumatic brain injury that results from the acute smashing of the blunt force injury versus a more subtle program?
Yeah, I think that that's an excellent question, Mark. And I think that we have some answers, but we still have more answers that we need to get for our patients and their families. And I think to start with your last question, I would say that what we do know is that mechanisms that cause concussion or mild traumatic brain injury do appear to be different from those that cause moderate and severe. And that, again, the picture that I think got painted is that even though we don't see anything on head CT or traditional standard brain MRI imaging in mild traumatic brain injury, there can actually be really long-lasting consequences because of the cellular level at which the injury occurs. And so I think that ends up being the critical piece there. We are looking for additional aids to diagnosis, as Jeff had mentioned, so that we can better objectively characterize these. But it doesn't mean that these injuries don't exist or that they're only figments of people's imagination. There actually are biochemical changes that do occur. And I think just to combine then the answer to your first question with one that we got from the audience about mental health and mood issues after concussion. Absolutely, there are psychological and emotional issues that can occur after concussion that are biologic and biochemical in nature. The exact characteristics are still being worked out, and as we know, psychiatry, neuropsychiatry are all areas where we are hoping that advances in imaging will make some headway. There was some comment on recent imaging advances in a condition like autism, which has similarly been plagued with the fact that there aren't objective measures. And I think the best story that I can tell you about this actually is regarding emotional symptoms after concussion is from an 8-year-old that I saw actually in the office. And we have gotten in the routine of screening every child that we see for mental health issues after a mild traumatic brain injury, because we know that sometimes they don't know how to express it when they're children. And I remember asking an 8-year-old, do you feel sad or down or worried more than usual after this injury? And the little 8-year-old girl shot a glance at her mom, and her mom said, "It's okay, you can tell Dr. Master." And the 8-year-old said to me, "I'm sad and I don't know why." And I think that that really just sums it up in terms of a biochemical aspect of injury, right? So she is 8 years old, has never had depression before, is not socialized to understand that, maybe she's got depression from a concussion because she's not doing her normal thing. She's 8 years old and she knows how she feels. And what she's experiencing really is a biochemical phenomenon that occurs after brain injury, where depression, anxiety, all of those things can occur because of the injury itself, not just because of the social circumstances in which they find themselves. And so I think it's important that we continue making headway along these lines to better understand that. And we aren't there yet. We're making progress, but we aren't there yet. And we can't lose ground on that.
Great, thanks. And I'll just join in by saying that we've done some pretty careful research. So as you're sort of getting the theme here, for really the last 20 or 30 years, we've sort of focused on what happens in a hospital or what happens on the sidelines. And now that we are studying patients more long-term, and we have actually very few long-term studies. So one is the model systems that Rick talked about. We also have the CARE Consortium, which has now gone on to follow folks a little bit longer. These are athletes. The Track TBI study, which I'm part of, has been following some of these folks for 9-10 years. And what we've seen is that there's a clear association. And we don't know, it's kind of like a chicken or egg thing. We don't know whether or not somehow or another the brain injury unmasks something that's latent, highly unlikely in an 8-year-old, like Tina just talked about, or is it the brain injury itself that's precipitating this? Also, we don't actually know where depression comes from. And so it may very well be that by better understanding this relationship, we actually might understand depression a little bit better as well. So lots of things to work on and things to think about, but there is a very tight association. And I mean, it kind of makes sense. I mean, all this stuff comes out from inside your head, right? And so if you injure the thing that's inside of your head, it's not going to work particularly well. And things like depression and post-traumatic stress and anxiety and sleep disorders, some of it, maybe we just weren't using enough common sense to think about this. But I think now that we're looking at it a little bit more carefully, we can clearly understand we don't know nearly as much about it as we need to. So,
if I could interject really quick,
sure.
Jeff. The one black box that we have in that continuum that you described is that we have no longitudinal studies of concussion or TBI in children, none. So again, we have a big black box in that area as well that really needs to be addressed. So thanks.
Yeah. Yeah, very important. I mean, it's sort of hard to go back into time and to figure all this stuff out. It's better to identify this kid, we just heard about this child when they're 8 years old and follow them long term, because we see all these papers about children failing in school and a history of TBI, or people that are incarcerated in their early 20s and like 80% of them or some ridiculous number have had a prior TBI. So these associations exist, but until we actually follow people in a cohort controlled way, we're not going to know about this. So another question that's popped up here, which I might turn back to Katie and others, is: are there any current or upcoming bills we should be aware of in the legislative cycle that we should have eyes on in terms of making a difference? Maybe Katie or someone else from our partner organizations here. Rick, you're on mute.
Hate it when I do that. Well, Katie's coming back online. I just would mention, just to underscore, the TBI reauthorization, the TBI Act, which is, for those who are taking notes out there, so House Bill 7208 and Senate Bill 4755, which is really designed to help funnel federal dollars through the Administration of Community Living out to local states to help state-based connection to resources and supports for survivors and caregivers. So I would encourage everyone to watch for that bill, to support that bill, and to understand the importance of including the chronic condition language that's been proposed for it, and making sure that comes into the final version.
Great. Thanks, Rick. Any other folks that are that are aware of any other legislation?
Well, I can tell you that funding for the BRAIN initiative has been drastically curtailed, and clearly some of the methodology that they developed would be instrumental in trying to delve to answer the questions that have been posed today. Addition, there should be a renewal of the Cures Act, and Cures will have funds to help things such as this should it get renewed.
Great, thank you. Tina, I'm going to turn this over to you. Are there differences between adult and childhood severe TBI? I'll let you answer that.
Yeah, no, that's a really excellent question. I think that there's a combination of factors there where, again, we have learned a lot and still have a lot yet to go to completely understand. Obviously, in terms of children, we are always very optimistic because of the fact that they are children and they have their entire trajectory ahead of them. And there is a tremendous amount of resilience in the nervous system for sure. That said, there is evidence that if you have a severe brain injury in childhood, that can potentially affect that basically affects what you have not already developed. You may have challenges in developing those skills if you sustain that as a child as opposed to as an adult. And so in many ways, a severe traumatic brain injury in a child is an area that really warrants intensive research to try and see what headway we can make in terms of improving those outcomes. And so while there is room for optimism there, there's also a substantial level of concern that severe TBI in childhood may have impacts beyond what you might see even in an adult who sustains a severe TBI, simply because that adult had essentially completed, full neurodevelopment into adulthood and had acquired all those skills through adulthood. And so while we want to be optimistic with the potential for resilience, there is also concern for an impact of severe TBI on that. And so that those are some of the ways in which there are differences between adults and children with regard to severe TBI, although there are also many similarities in terms of the tremendous impact on the patient themselves, their caregivers and their families, and really the whole concept of this being a lifelong ongoing issue when you have severe TBI.
Great. I'm seeing a question here about thoughts about hyperbaric oxygen. And this is a tool that has had sort of mixed studies, I guess would be the best way to put this. Certainly as a clinician, I've seen use of hyperbaric oxygen for wound healing issues and things like that. There's no question that it has a role. I think the problem that we see with this is, has the right study been done yet to determine whether it works or it doesn't work? Or more importantly, I'd like to roll back a little bit to some of the terms you've heard today: mild, moderate, and severe. I mean, how precise is the term severe TBI? You're talking about the most complicated injury in the most complicated organ in the body, and now we're going to call it severe. We don't do that with cancer, right? We subdivide cancers into the most narrow thing, and then we find things that work to treat them. And so it may very well be that there are certain subtypes of more significant or even less significant on appearance when people show up. And by this, I mean, like, you're in a coma or you're just recovered by the time you get to the emergency department. Different groups may be responding to this differently. And so what I can say is that when we've looked at this in aggregate, and this is true for almost anything that we've looked at, we haven't seen a difference. But a lot of us believe that that's because just like with cancer, the key to curing many of these cancers was to divide and divide and divide until we get a very homogeneous group that these patients all act the same way, and one targeted treatment targets that, but it doesn't target everybody. So what I would say is that a lot of the work that's going on, for those of you who haven't read it, just a nice overview would be this report that came out from the National Academies of Science, Engineering, and Medicine. Tina and I were honored to be part of that. And it's really a roadmap for clinical care and research. It came out 2 years ago, and it was set out to be a 10-year roadmap. And there's 8 recommendations that are in there. And recommendation number 1 is get rid of mild, moderate, severe, which we've been working with the NIH on. And by the end of the year, we're going to have some recommendations and guidance about how to use things like blood-based biomarkers that we talked about, and imaging, and clinical features, and all these modifiers to better subtype these patients so that we might find out who hyperbaric oxygen actually might work for. I take the belief that I'm not sure. The jury's still out in my mind. I hope that answers the question. There was also another question that says, there's current legislation on hyperbaric oxygen treatment for veterans with TBI and PTSD. Again, I'm not sure that we have the right tools to identify which veteran with what subtype of PTSD, because it's not just PTSD. There's various forms of that too, to really do this. So there's a lot of excitement. There's a lot of things that are in evolution. And again, all of these things require funding to be able to do this. Oh, and Jen's put in here that this is HR 3649 for those who are interested. There's also a question here now, and I see that we've got about 5 minutes left. And again, anybody that has any other questions, feel free to put them in today. Again, we are always available to answer any questions that you guys might have. If we don't have the proper legislation, then we will not have the funding to do what we need to get done. So we recognize the importance of all this. There's another issue here about our researchers seeing any correlation between TBI and a younger age and early onset of neurodegenerative diseases. The problem here again is not having a longitudinal cohort that's followed over time. Why do we know so much about heart disease and stroke? Framingham study. We follow these people 3 or 4 generations. That's how we know. And until we start getting some studies, set up to where we follow people over time, then, we're not going to have those answers. I wish there were a quick answer, but there isn't one. I see one question left here about what is the status of the CDMRP funding, and could we discuss the activities as possible? I don't represent that agency. I don't know that we can actually fully speak to this. Certainly, I have received funding from them, which has been very beneficial. I think the lion's share of the funding in traumatic brain injury has actually come from the Department of Defense entities over the years, and we're all very, very thankful for that. But this is more than just a military problem. This is a public health problem. And again, I would hope to see legislation coming through energy and commerce, through appropriations bills and so on, that speak to the need for places like the National Institute of Health to think about allocation of funds in this area. That, other things through Health and Human Services like the CDC don't get defunded, but get more funding. So I think there's a whole lot of areas that we need to work on. The combat casualty care and the DoD should not be carrying this alone. So, I'll stop here and see if there's anything else. Katie, I don't know whether you want to wrap this up, but
I could chime in real quick to follow on just
go ahead.
CDMRP. Clearly, the DoD is interested in this, but it's primarily in young adults and older. And while we're at Children's Hospital of Philadelphia, and we've been very, very fortunate and grateful that we do study and take care of young adults, so we have received funding from CDMRP. The vast majority of children in pediatric research and concussion, traumatic brain injury is not really funded by CDMRP because that is not an age range that they're interested in. So again, we're forgetting our children. And so again, we do not want to forget our children and our young adults. They really are our future. They are going to be the key to our understanding brain health long term. So really, really critical that we make sure that we ensure funding for all of our populations so we understand brain injury in those and across the age range.
Great. Well, seeing no further questions here, I don't know whether anybody else that's on the panel would like to have any closing remarks. I'll open it up for a minute.
I'm just going to close things out. Can you hear me?
Yes, we can hear
you. Finally, okay. And thank all of you for contributing so mightily to this fascinating briefing. And thank you to the audience for listening. And as you said, any questions, keep putting them in and they will be answered. And on behalf of the American Brain Coalition, I'd like to thank you all for your interest and your passion.
Great. Thanks, everyone.
Thank you.
Thank you.